You know, getting an unexpected result from a scan, it's just unsettling, right? One minute everything's fine, and the next, your doctor is telling you they found a mass on your kidney. Your head starts spinning with a million questions. Well, today, we're going to clear the air about one specific diagnosis and show you there's a lot of reason for optimism. So maybe this is you. You've just heard this big, complicated word, angiomyolipoma, or AML for short. And anytime you hear the word tumor connected to an organ like your kidney, it's totally normal to feel a wave of anxiety. What does this mean? What happens next? Okay, let's just take a breath, pause that racing mind, and get some real clarity. First things first, and this is the big one. An AML is a benign tumor. Let's say that again. It is not cancerous. That right there is huge. And just as important, you are not stuck. You have options, really good, modern options. And that's exactly what we're going to break down right now. All right, so let's dive right in. Before we can even talk about options, we've got to understand what we're dealing with. What is this thing that showed up on your scan anyway? That name, angiomyolipoma, it sounds like a mouthful, I know, but it actually tells you the whole story. Angio means blood vessels, myo means muscle, and lipoma means fat. So all it is a harmless little bundle of those three things. It's not some alien invader, it's just a mix of normal tissues that grow in one spot. And here's the crazy part. Most people have no idea they even have one. They're usually tiny, cause zero problems, and get found completely by accident. You know, you go in for a scan for something else entirely and, surprise, it's only if they start to get a bit bigger that you might feel a dull ache in your back or side. Okay, so you're probably thinking, if it's not cancer, why do we even care about it? And that is a great question. The issue isn't the tumor itself. It's those blood vessels inside it, the angio part. If the AML gets too big, those vessels can become fragile and have a risk of bleeding. So the whole point of treatment isn't about fighting cancer, it's all about preventing a bleed. Now, for a long time, dealing with that risk put people in a really tough spot. The choices were they were black and white, and neither one felt perfect. It was a real dilemma. And here it is, the old rock and a hard place. On one side, you have watchful waiting. This is great for small AMLs, but it can feel like you're just waiting for the other shoe to drop. It can be super nerve-wracking. On the other side, you have major surgery. Sure, it gets rid of the AML, but here's the kicker. It often means removing a chunk of your healthy kidney, or sometimes the whole thing. But what if there was a third way? A path that avoids both the anxiety of waiting and the cost of major surgery? Well, this is where the story gets really good. Let's talk about a modern approach called embolization. I mean, just think about that for a second. What if you could solve the problem, eliminate the risk, and keep your kidney completely whole? What if you could get that peace of mind without a single stitch? Well, it turns out you can. It's called angiomyolipoma embolization, and the idea behind it is just brilliant. Instead of cutting the tumor out, you stop the problem at its source. Think of it like this. Instead of demolishing a house to fix a leaky pipe, you just find the right valve and turn off the water to that one pipe. Embolization cuts off the blood supply only to the AML. The tumor gets starved, it shrinks, and the healthy kidney around it is left completely untouched. So how does it actually work? It sounds like science fiction, but it's incredibly elegant. It all starts with an entry point no bigger than the tip of a pen, usually in your wrist. A tiny, flexible tube called a catheter is guided through your arteries using live X-ray like a super precise GPS. The doctor navigates it right to the blood vessels feeding the AML and then releases these microscopic beads that act like a roadblock. They block off just those specific vessels. And that's it. The catheter comes out, a little bandage goes on, and you're done. No cuts, no stitches. The procedure itself is pretty amazing, for sure. But what you really want to know is, what happens next? What's life like after? And is this something that could work for you? This chart just says it all, doesn't it? Look at the difference. A large incision versus a tiny pinhole. A hospital stay versus sleeping in your own bed that night. Weeks of recovery versus being back to your normal routine in about a week or two. But honestly, the most important line here is the last one. It's the real game changer. You preserve your healthy kidney. So who should be thinking about this? Well, see if any of these sound familiar. It's a fantastic option if your AML is on the bigger size, usually over 4 centimeters, or if it's growing. It's definitely for you if you've already had symptoms like pain, but it's also for anyone who's just thinking, I'd really rather avoid major surgery if I can, and for anyone who wants to protect their kidney function for the long haul. Now,
One thing to know is this isn't an instant disappearing act. This treatment works with your body. Think of it like a plant. After you stop watering it, it withers away over time. The AML will slowly shrink over the next few months as your body's amazing natural cleanup crew takes over. It's a healing process, and it's all moving in the right direction.
So I'll leave you with this question. Just take a moment and imagine, what would it feel like to know the risk from your AML is handled, but your kidney is safe and sound? To finally put that weight and worry anxiety on a shelf and just get back to your life. For more and more people, that feeling of relief is becoming a reality, and it all starts with a procedure that's no bigger than a pinhole. It's pretty powerful stuff to think about.